medicine used to be the ultimate dream course, but in 2025, is it still worth it? If your goal in studying medicine is to make a lot of money, you might want to just rethink that. Hello guys, welcome to my YouTube channel. I'm Dr. Imelda Kene. So today we'll be talking about why medicine in 2025 and whether it's still worth it. Not hype, not hate, just a balanced perspective. I decided to make this video because quite a number of people are confused on the course to study, and they're asking a couple of questions, especially with regards to medicine, whether medicine is still a suitable choice of course to study in 2025, especially with the way the world is now, AI, tech. So as a recently graduated medical doctor, I'm going to be telling you guys what I think about the course medicine and whether it is still worth it in 2025. So if you're confused, or if you're an aspiring medical student, maybe you just graduated from a first degree and you're wondering which other course should I study next, should I study medicine, or you're done with your secondary school and you're wondering, okay, should I put in this medical school thing, then this video is for you. So stay tuned and let's dive in. We're going to be talking about it in two different aspects. We're going to be talking about why medicine still matters and what has changed. So we're talking about kind of like the benefits of medicine still. One of the very important benefits of studying medicine or becoming a doctor is the job satisfaction you get. Medicine gives you a sense of purpose. The ability to see a patient, walk into your hospital almost at the end of their life, watching the relatives very confused and in fear, and then you kind of like do your thing and administer the medications, treatment, and the patient gets up and is perfectly well again. I think that is like a miracle in itself. It gives doctors a sense of purpose. It gives you a sense of satisfaction with your job. Now, the second benefit of studying medicine is that medical doctors will always be in demand, right? Medicine is of global relevance. It doesn't matter where you're practicing, health workers are essential and skilled professionals are needed everywhere. Whether you're in Nigeria, whether you're abroad, you will always be needed. You've probably watched movies where something comes up, they're asking whether a doctor is on the plane or on board, whether there's a doctor nearby. Health professionals, or medicine rather, is a skill that will always be in high demand. It's a skill that will always be needed wherever you are. Now, the third reason why medicine should still be your course of study even in 2025 is that there's diverse career paths to specialize in, really. So you must not niche yourself to clinical practice. People are diversifying into health tech, public health, content creation, even into business, and really just different things. So you don't have to hold back, maybe because you don't want to specialize in clinical practice. You can still study medicine and make the most of it, even if you don't want to go into clinical practice. It's been a long thing coming that doctors are respected. Medicine is a noble profession, and guys, it's actually still true even till today. You enter some places and people just give you free access, really, just because somehow they get to know that you're a doctor. Sometimes they are addressing you in a particular way, and then when they just learn that you're a doctor, they almost go 360. So the medical profession is still well respected even in today's world. So unlike some other jobs where you get layoffs regularly, there's just job security. The medical field is rarely like that. The job is more stable and there's rarely layoffs and all that, especially with clinical practice. Now, one of the very important benefits of going to medical school, for me, I would say, is the life skills you get to learn in medical school. Medical school teaches you resilience, it teaches you time management, and just the sheer ability to strive, really. There will be moments in med school, because of the way the curriculum is, the volume of work, in a bid to try to survive medical school, in a bid to try to navigate your way, you kind of like pick life skills that are important and that would carry you throughout life. Sometimes I used to say that if you're able to survive medical school, there's hardly anything you won't be able to survive. It just teaches you a lot of life skills. Now, what's changed really over the years? Medicine has quite some disadvantages that make people in doubt about whether to study it or not. And one of them for me would be the long, intense years of studying. I graduated from medical school and I spent 8 good years in school. It's not the same for every university, especially in Nigeria. There are some you have less than that. You have 7, 6 years. Some others you have more years spent in school studying medicine, right? Which is just not really the best. If your goal in studying medicine is to make a lot of money, you might want to just rethink that. Not that you won't make a lot of money if you study medicine, but it's just the amount of time it will take for you to make that money. The long and intense years of studying, it can really discourage a lot of people. You might want to look into other paths. There are other things you can do now. You can literally learn a tech skill that can help you or aid you in earning as soon as 6 months to a year. Another important or really great disadvantage is the burnout and stress is really real, even throughout the practice, right? You're constantly feeling burnt out, you're constantly stressed. You feel like the work you're giving, it's not commensurate to the remuneration, which leads me to my third point, which is underpayment. In a lot of countries, especially in countries in Africa, like Nigeria, in fact, the National Association of Resident Doctors in Nigeria are currently on strike because of the underpayments, and this has been going on for like a really long time. So in most countries, like I said, especially in Africa, the pay is almost nothing compared to the job, compared to what you're putting in constantly, compared to what you're giving, your time, your effort. It just costs a lot of emotional stress, even physical stress. So yes, it's almost like burnout is inevitable. No matter how you try to manage your work and your life, you get burnt out, you get stressed. And that is especially seen with clinical practice. So if it is something that you are really trying to avoid, you might want to look into other career paths that can help you better manage the burnout. And the fourth one is that there's limited flexibility in clinical practice. There's limited flexibility and even creativity, and this is especially seen with clinical practice. You will mostly see your colleagues in like tech, business, seem to be making much more than you are doing as a medical practitioner. I mean specifically with clinical practice. Okay, so generally, medicine is still a profitable course any day, anytime, and even in 2025. It has disadvantages, but it has a couple of advantages that are also still good. And I think personally that the knowledge of the body, the way your body works, the anatomy and physiology of your body is still very important to know. Right, that ability to save people in emergency conditions, just anywhere, anytime, it can never be overemphasized, guys. So yes, I think that medicine is still worth it starting in 2025, but that is especially when you do not view it as a final destination like I do. I think I look at it more like a foundation, which you can build different things on it. You can do literally anything you want to do with it, but yes, it is still worth studying. So if it is something you want to do, I would encourage that you go ahead and do it, but know that the world is changing, and as doctors we should change with it. And if you're thinking of studying medicine or pivoting from it, then leave a comment in the comment section. Let's talk. And don't forget to like and subscribe if you liked this video, and share it to anybody you know that is just in a bit of a limbo whether they should study medicine or not. And I'll see you in my next video. Bye.